everybody looked at it? Any questions or anything?
Now that we're in open session, we remove the closed session items.
Yes. Thank you. And so that's what we were going to do, or we are going to do, is the closed session, which was number I, is removed from the agenda. There are
Okay.
no updates.
INJ.
I and J. Because if we're not having I, Scott doesn't have to report anything. Thanks for being here though, Scott.
My pleasure.
I just have a question. The cafeteria plan, that resolution. I understand we need to approve that. I don't remember approving the cafeteria plan itself. Because,
We did one 2 years ago. We thought it
you
was-
know, the amount of contribution and the amount that the employee pays. That can be done, should be done every year. And we should be paying more than 70% is what I'm getting at. It should, and it goes in steps up. And with the employees getting beat up, getting hit up
So,
every way.
Gene,
So if I may, this is an item on the agenda, and the time to discuss that would be when that item comes up.
That was my question, if I can do that.
yes.
Of course you can.
When it
Any
comes up.
any topic related to that resolution you can discuss.
Okay, that was my question. Thank you.
You're welcome. Scott, thank you. So, so do we have an approval with the
I'll make a
removal
motion we approve.
of H and I? John, your vote?
Yeah.
Yes.
Hang on a second.
Yeah.
On my agenda, John is not listed on the cover page.
It's on page 2.
Yeah, page 2.
Bottom of page 2.
It's on the bottom of the agenda. The little box right above the posting date and time.
Okay, in the future, let's just put him right between the notice and the remote participation.
Okay,
We'll let, yeah, just for future reference. Sorry about that.
That's okay.
I'll second. Should be fine.
Thank you.
Yes, ma'am.
And your,
Yes.
Jean?
Yes,
Yes.
Yes.
Ross, I was like, you're usually on that side. And I'm a yes. So now that we have the approval of the agenda, if we can do the flag salute.
Everyone, please stand. Right, just in the corner. Right hand on your heart. Pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you. Mark?
Heavenly Father, we just come before you this afternoon to deal with situations dealing with the Kern Valley Healthcare District. We are grateful for all the water that you've provided to our lake community. We ask that you give us just a little reprieve from the heat of the summer, but if it be your will, Heavenly Father, we also are grateful for the many blessings that you've given us. Please guide our decision-making in this meeting. In Jesus' name, amen.
Amen.
Mark. Number 3 is the mission statement. I don't see anybody from the public. Our mission statement is we will provide high quality, efficient patient care services that respond to the community and provider needs. We will provide leadership and health promotion and education for our patients, residents, medical staff, employees, and the community throughout the district. And I don't see anybody.
Did I accidentally touch something? I don't know what that screen. Apparently, we're going to Costco.
I'm gonna blame IT.
Are they having a sale?
I just wanted everybody to know.
All right, perfect. Thank you for that. So at this time, I don't see anybody from the public. Our newspaper is here, and I always forget your name.
Oh, Calvert.
Oh, Catherine, how could I forget that?
$1 Karen.
That's why it's so easy, I guess.
I call.
Anyway, I'm glad that you're here with us today. And on D is the consent agenda. We're going to need action on these. The following items are considered routine and non-controversial by staff, by hospital staff. Consent items are listed as action items and may be approved by one motion if no member of the board or audience wishes to comment or ask questions. If comment or discussion is desired, the item will be removed from the consent agenda and agenda will be considered separately. So, does anybody have any questions on the consent agenda or anything that needs reviewed?
Motion to approve. Second.
Now, are we doing this twice because it says May 29th? And we would have done this from the previous meeting and June.
We didn't have we had,
Which one, Chief?
yeah, good question, but
All of it. We didn't have any meeting with consent for this month.
no, we're looking at June's minutes, right?
Board of Directors meeting,
Right. But we're also,
governance May 28th. We would have approved them at the last board meeting.
from the last meeting.
Look on the other page, Chief. Not that one.
Oh, not, okay.
There you go.
Your agenda.
Just on the agenda, sir.
Oh, okay, okay. We're approving the agenda.
Yes, sir.
Well,
The consent
are
agenda.
we?
Okay, the consent agenda.
Yes, sir.
Okay, the consent agenda. On the next page, what's that for?
Those are the minutes from the last meeting that you're
We're approving them.
From the last-
having the last meeting.
Yes, sir.
For June,
June 13th.
Okay,
okay? And your vote?
yes,
Okay. Thank
but
you.
there's no consent agenda for the last meetings because we didn't have it.
Correct, but there's stuff that they posted as part of consent agenda for this packet, even though those meetings didn't happen.
Even though they didn't
These
have,
3 items right here.
okay.
And one additional item on the back.
Oh, sorry.
Foundation report, CNO, CEO. Which are in the packet. Number 4 on the top, just that one item.
Yeah, okay.
Okay,
I'm sorry.
Yeah, you're good.
yeah. You're just, keeping me to task. I appreciate that. I may need some of that oxygen. Ross, your vote?
Yes.
And John, your vote?
Yeah.
He's in Texas. He's got that long draw. And I'm a yes. So, the first one is the Board of Directors meeting minutes from June 13th.
Yeah.
And then we have the CNO.
But that, anything else?
Which one did he do? Okay. So, I was thinking we were there. So I understand, Mark, you're going to do Tim's.
I have the report that was emailed a moment ago. Yes,
Can you?
happy to,
You would
happy to
appreciate.
provide that
Thank you.
written. So this is the CEO report that we received. The first item that he has on here is the transfer switch. The emergency transfer switch that provides backup power to the acute care unit, the ER, lab, and to the IT department went bad on July 4th. When staff was running a test on the system, the power failed to trigger our emergency generator, and we briefly lost power to the affected departments. That switch was 56 years old. I'm older than that. And was no longer serviceable. Our facility manager notified all of the appropriate agencies and was able to quickly find us a switch on a rental basis. until our new generator is operational early next year. The new switch was installed on July 10th. Electricians were here this morning to do the power hookups. The switch has been tested and was able to start our generator. Additional tests are being run to assure the switch will shut off the generator once power has been restored. Any questions? Good, good.
Yeah, I know. I think we're in the wrong business. We should be renting electrical equipment.
We should be
and-
providing rentals for other,
Yeah, that's what I'm thinking.
Yeah.
John, can you work on that for us? Another line of business for us?
Yeah, because
We did have our managers retreat yesterday. We held our managers retreat offsite to provide valuable information on performance communications for the leadership at the hospital. The educational session was put on by Beta, our liability provider. Discussed were different communication strategies that can be employed when providing feedback to our employees for either good performance or when improvement is necessary. The sessions had exercises for everyone to improve their communication skills and to be more accurate in stating our expectations and outcomes that are required. This is the start of an ongoing educational effort to improve our managers' capabilities. It was well received by all. I would agree with that. We've had a change in management in our Mountain View Health Center. I'll defer to Greg on this one.
Just that Miranda Everett has assumed the role of manager for Mountain View Health Center. Cody Bogarelli is still here and he's focusing his attention on his busy schedule, and Miranda's already started off. She's working with staff and it's going great.
Thank you.
yeah, that's a big task to do.
Say, very good, great
Yeah.
job.
Yeah,
Big shoes to fill. We held our CNA graduation ceremony on June 26th. We had 11 students complete the program, and most of those have already signed up for their certification exams. They are also filling a NA schedule, most of them on the skilled nursing center already. The ceremony was very moving and the class was arguably the best we've had. Much thanks to Ben and Joy for their efforts in teaching the class and getting them ready. We also want to wish Ben well in his future endeavors, as he'll be leaving soon to move east. He's a fantastic person and a valuable employee. He is welcome back at any time. We probably want to handcuff him to a chair.
Yeah.
But yeah,
the students had, I mean, they really enjoyed,
glowing review.
yeah, they felt they learned a lot from him, so.
He's valuable, that's for sure. Our team on the QIP program. Our team has worked very hard in meeting our metric objections for this last year. We hope to come close to maximizing our overall results. Much discussion has been held regarding our continued ability to meet our expectations. Program changes and reporting requirements have made it much more difficult. We are hopeful we will get our approval for the acquisition of the I2I program that will help with data capture, analysis, and reporting. It may also allow us to take on even more metrics, which would improve our patient care quality and our financial rewards for hitting the metrics chosen. Maybe Dad.
But we're going to be talking about it. So that agenda.
Okay, fair enough.
Talk about it.
Right. And then last but not least, John Leverich has started in his role as the CFO. He's already dug in reviewing our financials, meeting with his department managers and staff, and in identifying areas of opportunity for revenue growth, cost controls, and improved efficiency in our billing effort. That is the report that was provided.
Did he bring cash with him?
Has it in his sock.
Cool, cool.
So,
Welcome aboard, John.
Thank you.
yeah, absolutely. And thanks for being here. Looking forward to the different things that you'll teach us and how the news is, how you guys are gonna work together. And I'm sure that's gonna go well. I just know that the reports that we get sometimes are before you, they were kind of hard to either read, follow, or stay on track. That I guess is a nice word I'm looking for. They changed a lot, so.
I heard about that, and that's why I kind of want to ask you guys what would you like to see? What would help you understand the financials a little bit better,
Okay,
either through graphs or scheduled or something like that?
When we get to it, I've got some things I would like to think of. You get to
All
it.
right.
Now, I was fortunate enough to see you in Tim's office before you got hired. And you look better today than you did then.
Good, maybe I'm getting better. Maybe next week will be better too. Thank you.
So on our reports, our number 2 is the CFO financial report for May. So if anybody has questions, we want to, we'll need to take action on it and accept the financials as presented. Does anybody have any questions on them?
He's not gonna go over it at all. In this
Yeah,
first
he
case,
can.
I would like to see it now this first time because I had some questions, but
Go ahead, you can ask questions.
well,
Either I or Amy can answer them. Amy, she prepared these more than I did actually, but I helped her. I was just got here 2 weeks ago, but we've been working on them.
I didn't mark down the questions.
Did you just want us to start from page 13
I
and
see-
start
I
going
see
through?
what's that.
Or-
You can?
One of the questions I was gonna ask you if you could do
Yes.
from a measuring point. Our skilled nursing, when we put that in, it was supposed to help us when we didn't get enough money in the acute to help us operate the hospital. Because we have a hard time operating it without extra cash. We're capable of, is it 165,
170,
175? And we sort of hung in at 165 for,
I mean 74,
70.
thinking 100, yeah.
So
we hung in there
patients you're talking
at
about.
165 census, yeah, for forever.
You're at 100 too.
Yeah.
Yeah, I'm sorry, it's only 74. I
Oh,
misspoke.
I'm sorry.
Right now, we've got about 44 in.
Okay. Yeah, and now we're down to 74. Because there's a variation, the less you got, the less expenses. So you can't get a really true picture of what is costing us to be down.
One of the projects Tim has been working on is to see if we can't get Medicare patients in there,
Okay,
which would bring our census up a little bit.
okay, well,
that's what we're
we
trying to
said,
do.
we said 5 or 6 years to do that, and it's just steady gone down. Tim in charge, okay?
Okay.
So,
Can't speak to 5 years ago, but I
I
can
know,
tell you.
I
what's
know,
happened.
okay.
We're gonna get some more patients in there because that's what Tim wants. And one way or another, we'll do that, either through more Medi-Cal patients, managed Medi-Cal patients, or Medicare patients. I'm researching right now, how do we get Medicare patients in there? You don't usually have Medicare patients in long-term cares because usually you build the ancillaries through Medicare and everything else goes through managed Medi-Cal. But we're looking for a way, I'll figure out a way to get the Medicare patients in there. Tim seems to think that that'll improve us at least 10%, which is 5 patients, but I think it'll even improve us more. If we can get, he wants to get up to 65. We can do that, cover your fixed expenses, and you're also contributing some to
so
everything else.
So the fixed expenses at 44 as opposed to 64.
Okay.
You know, how much would it make us to go ahead and be up to 64 is my question.
If you add 20 patients, you're not adding the same amount of nurses.
Right, right.
So you're only going to add maybe 2 or 3 more nurses. So you're getting extra revenues and your expenses are going up at a lower rate.
Could you do a scale to where roughly it would show that?
I can do a pro forma on that, no problem.
I mean, it would give us a better idea of how much money we're really losing. Maybe I've been bitching for nothing.
Not sure what
Maybe
Lisa,
we're better off at 44.
well, I wouldn't say that.
Okay,
I wouldn't say.
And
But one of our problems was we didn't have enough staffing, but now that we have these CNAs that just graduated, that's going to contribute to a bigger margin because we were having registry in there before, if I'm not mistaken.
Yeah, absolutely.
Which costs probably twice as much as an employee does.
right.
Now
More
we have
than,
11,
more than twice as much.
more than twice as much. So we have 11 new employees in there. we could, sky's the limit on how many patients.
During COVID, it was 3 times the number for a CNA that we were paying
Right.
what a normal one of our CNAs make. So it was high expense.
And after this election,
I don't want to talk about it.
things could change drastically. We could have people that want to work. I mean, weird things happen. But,
Jean, and those are all questions you can bring up at finance.
This
Me
this
too.
is finance right now.
Right, I understand, but in length.
We didn't have a finance meeting.
No, we didn't. But I mean, you can bring it up at the next finance.
And I'll have a pro forma ready by then. And one of our problems also is long-term care, is we're having a problem getting paid from our payers right now.
Well, I'll say it's all Medi-Cal, so why would you have a problem?
It's managed Medi-Cal actually now, so it makes it more difficult. And probably part of the problem is the authorizations, we're not receiving them in a timely manner. So until you get an authorization, you can't even bill. So right now our AR is going up there, and that's one of the areas I'm really going to concentrate on. We're already starting to look at that.
So you're, okay.
On top of that,
Oh, yeah, that's awesome. That's,
that's my number one priority.
Music to Gene's ear.
Yeah.
yeah, it is. It is. The last guy that was in here, I'm gonna repeat his, every time he opened his mouth, he says, I'm here to make Tim look good. You're not here to make Tim look good. You're here to make the hospital work good.
Nice if I could make.
I mean, and if Tim looks good, that's fine. That's
Yeah,
great.
right.
You know, that's not a problem.
The hospital do well. Good.
But I can talk about finance now.
Yes, you can. I was just saying, if you want to continue to go into something more in depth, you can do that at the next finance committee. I just want to kind of stay on track. Because we want to look at the report we have in front of us too.
Okay, and I might give you a range if some of these things that I didn't
You can call me
have
anytime.
question on, but right now, I thought mark them down. I thought, no, he's gonna go over it. I'll just pick it out as he goes over. Okay, thank you.
But they can go over which, if there's.
It's fine. That part will wait till, and I might comment at some specific, but it'll be fine.
Okay,
Can I ask a
Thank you.
question?
absolutely.
On page 23,
23.
basically your summary,
Yes.
and it looked like May was a negative month for that, for us. Is that something that we should be concerned about?
I wouldn't say so, not right now. I mean, the reason we were so far behind from last year comparisons is we received ERC money and some other, about $1.5 million in that was below the line. So that's why it makes it look, skews it a little bit.
Okay, all right.
But as far as everything else, our revenues are pretty much in line. Our expenses are, per month, we're all right. Year to date, we're a little bit high, mostly in the employees because they received a bonus of $750,000,
Yeah, that's what that
Okay,
$750.
that explains.
So that increased it a lot. And then our benefits are a little bit high right now. I'm looking into that, why that is.
Hmm.
Looks like FICA's a little bit high, too high, which skews it a little bit also.
Okay.
But I'll look into that.
Thanks, John.
When you find out, I'd like to know too, because I'm having to pay more in my business.
Let's see, any other questions on any of the financial stuff?
Right.
No.
Next month will be a little
That's
bit more.
exactly
depth.
what I needed to hear. Thank you.
John, do you have any questions?
No, Catherine, I'll wait till the finance committee meeting later this month.
All right.
Everything typically for John just yet.
Okay, perfect. Thank you. Is there anything else, like if you want to cover? I know we didn't have a finance committee meeting last month. And so we're looking at the month of May right now. I think the summary was, I was pleased with it, maybe not whole numbers, but just to have that summary was, makes it a lot easier to just get a quick view of what's really going on. So I appreciate that.
What else would you like to see, everybody? Would you like to see some graphs? Would that help you to understand the numbers better? Some trends and things like that?
Right now, what you did, or the way it is, it's readable, other than what the.
I actually, Catherine, I did have a quick question for John, if that's okay.
Okay, let Jean finish and then,
Other than what you did,
I'm
still
sorry.
nursing on,
it's okay.
on what it's really costing us to be down and
Right.
what will make if we go up. Because, and with the current, CNAs, so that we might need to just rent out skilled nursing to somebody who can operate.
Okay,
Wouldn't say that yet, but
Okay,
yeah.
Okay, go-
Let's get the numbers first.
go ahead, John.
Okay, John, the only question that I had, the last two CFOs we had, used to do a product, well, actually, the one CFO that we had, Chet, always used to do a product line summary. The last CFO, he kind of brought it back a little bit, but didn't really fine tune it very well. And basically it was kind of a breakdown of what each department in the hospital was doing, financially, their utilization, their expenses, et cetera. Would that be something that you could possibly bring back to the monthly finance committee meetings, or at least look into it? Or maybe you have your own version of it that the board could look at?
We can do that, no problem. It's in the system. We just have to print it out, really. We go by departments. The departments fill up to the statement you see right here, but we've got it by departments. That's how we build it. So that won't be a problem.
Okay.
And I can expand on that as we go. Right now, I'm just trying to figure out what you guys want to see, which would be helpful. These are pretty basic right now, but I could expand on this summary, and I can bring more reports into if you want.
Okay, does anybody else have any questions or anything?
Can
Ross,
I- Can I just add a thing? It helps for the managers used to get a report of their departments too, and I don't believe departments get to see what revenue they're generating either.
That same product line summary went out to the managers.
What
Yeah,
I'm planning on doing is meeting with the department heads monthly to go over their expenses and their revenues and ways to improve things, or listen to what they have to say and what we can improve things too. I think that's important to have department head meetings every month. And Amy and I are going to do that. We've already started meeting with them for budget purposes, but we're going to do that for financial statement purposes too.
that would be great. Thank you.
okay.
One of the things that, the previous CFO had provided, and it kind of fell off, but it was, on our big construction project, we haven't started yet. I mean, we're spending some of that money like on the generator and some other things. But it was a picture of where we were on that project, from a cash flow perspective.
As far as how much money we've spent so far, where we are, as far as like percentage of completion, things like that.
Yes, and what's still outstanding, and do we have the cash to finish it? Obviously, we don't unless we get that FEMA grant, but.
And as far as what's left, and then can we complete it? That may be above what I can say. We need a construction person in for that probably, but I could work with him and understand a little bit better.
It could be based on what our current assumptions are. That's fine. It doesn't have to.
Yeah, that's no problem.
Yeah, it doesn't.
Actually, Amy has CIP stuff right now already. We can talk about it if you want.
Well, I don't need it today. I just wanted to be able to look at that and see where we were on
No problem.
where our cash is on our construction project.
And a stopping
That was
point.
previously submitted.
Yeah.
And
Yeah.
where do we stop if we need to? So if we have no other questions or anything, if you want to, take it ready for a vote. Again, the recommendation was to accept the financials as presented, and these are for the month of May, since we did not have a June meeting.
So move.
Jean, your
yes,
vote, yes? John, your vote?
Yes.
Ross, your vote?
Yes.
Fred, your vote?
Yes.
And I'm a yes. Sorry, John, it just seems like you got a Texas,
Got a draw.
draw going in there from us, on our end anyway. Sounds good on you.
You want me to use a Texas accent too? I can do that.
Maybe.
Remember, everything ends with y'all, okay?
I'm gonna say, I'll start saying y'all.
Yo,
Thanks, y'all.
off topic, what's the temperature there?
Right now it is 92 degrees, but about like 90-some% humidity. So
Well, don't bring it
it's
back
not better
with you.
than.
Yeah, no kidding. Okay, so we're gonna move on to G, which is in the new business. The first one is the resolution for for approving the eye-to-eye master agreement.
So let me start this conversation off. And just so you all know, it's 67 degrees here and sunny and beautiful, so don't be jealous. I'm gonna go midnight golfing after this meeting with my brother-in-law and my boys, so
I feel
anyway,
cooler already.
yeah.
Oh my, 62.
And just so you know,
Oh,
it was 118 from Paradise Cove to Mountain Mesa.
That
According
is
to my car.
crazy.
Yeah,
It hit 72 here and it's a heat wave, so everything's relative.
oh, that's awesome.
All right, so for under the healthcare district law, telephone and telecommunications and software data processing systems that cost $25,000 or more have to be competitively bid. Greg can talk more, or Carrie, one of them can talk more about the details of the system. My only input is that after searching for providers who may be able to submit a proposal for the district's needs, Eye2Eye was the only one that was able to do that. And so because the bidding process, the RFP process, would have been futile, and we wanted to get this QIP system in place. What I've done is I've drafted a resolution for the board to authorize the purchase of this software without doing the standard competitive selection process, because it would be futile to do so. If the board has any questions about that, Greg or I will be happy to answer them. But that is why you have a resolution before you to go along with the purchase of the software.
Now, when you're calculating the over 25,000, the setup cost is pretty substantial, or it's part of it. Do you gauge it from the ongoing cost, or how do you do that?
It's total contract cost. So if it's a multi-year contract, you calculate in all those costs. If there are startup costs, training costs, there wouldn't be shipping with this, but if it was a piece of equipment that required shipping, it's the district's total all-in cost. And the reason for that is the policy behind that is the state wants to make sure that the public funds are being used in the most efficient means possible, and that public agencies are not showing favoritism to particular vendors. And so anyway, it's an all-in analysis. What are the total costs for what you are purchasing?
Well, seems like there'd be a better way to do it. However, it is what it is, right?
Yeah, it's just an RFQ process, which is pretty standard. So it's also keep in mind, it's under the RFQ, the analysis is what is in the best interest of the district. It's not necessarily lowest cost. The district can evaluate the proposals and determine which one is in its best interest. For instance, if the low bid was not compatible with an existing district system, but the second lowest bid was, then you might go with the second lowest bid, because you would have conceivably fewer costs in the long run in terms of integrating. So yeah, so it's a best interest analysis for this type of acquisition.
So you put this together, the entire,
No, just the resolution.
just the resolution.
So I did the resolution and I have reviewed the contract, and I sent my comments to Carrie and Greg. So I have looked at it.
Okay, what's the comment? What did you comment? Just one look at?
You want me to pull up the contract and go through all of my comments to them?
I would, yeah, I'd like to, unless it's when you're saying all of them, it doesn't sound like there'd be too much.
Well, let me shortcut this.
Okay,
Does the version that we have in front of you include your comments? The change is
great.
relevant to your concerns?
Actually, I'm not sure.
Yes, it is.
Just because the first page, I think, has the wrong address. And I know that that was one of his comments, unless somehow I have a weird version.
But you're okay with it basically.
Yes, so we had some back and forth on my comments. There are some standard legal terms that all of these software providers put in about limitations of liability and waivers of liability. And so I go back to them, the state of law, the district's defenses and immunities, right? So I make sure that none of that stuff is taken out or waived. On the technical side, Greg and Kerry look at that. Its compatibility with existing district systems, downtime metrics, support, like all the business terms and technical terms, Greg and Kerry or whoever else at the district would look at. So they would be able to address those issues better than I would.
I looked it over and totally didn't look bad to me, but what's his name? Ross. You seem to look at it with a fine tooth
I know
comb.
there are a few.
I did. I didn't have any concerns about it.
Okay.
The first thing I noted.
Okay.
Okay, good.
When I,
Okay, can I make a motion we accept it as presented?
I submitted that part and I sent the wrong, I made the wrong, I guess my Colorado now, so forgot my home address. So, we can change that. That would be the only change that I saw. I went over the rest of Scott's proposal or recommendations. They were minimal changes. I know there was one changing a late payment fee from 1.18% interest to 1%. There was really nothing of major substance, and we submitted those recommendations to the I2I, and they did. They said that was fine. Other than I messed up on the items.
So
I was going to say, I apologize for interrupting. I just looked at the limitation of liability waiver and governing law sections, and they all include my changes.
Good.
So we have a motion to accept as presented. And I want to just make sure that they're going to include the changes, instead of 4312, it's 6412.
Right.
Change the address with the few changes. Okay. Okay, perfect.
I know we spoke about this agreement at the last meeting. I'm happy to review it. And anyway, I know it's an extensive agreement, but it's, I think if we don't use this service or something like this, then basically we'll be excluded for participation in future years from the QIP program. Right now, the funds that we're scheduled to receive, if we hit all six of our metrics, is about $2.5 million a year. And it's based per metric, but it gets a little bit more complicated. But if we were to miss one metric for 1 year or in just 1 year, then that basically be the same cost of the total all in for this contract.
Right.
This year, we just submitted our report to the state, and this is unaudited, but our unaudited, out of our 6 metrics, we had, I believe it was 5.87. So as long as we pass the audit, then we should be getting basically most of that $2.5 million.
Can I get a
I'll second the
second? Okay,
Thank you.
you're welcome.
So we're approving the resolution and the contract, correct?
Yes, both.
Yes, the resolution itself approves and authorizes the contract.
So, and it was last month that you presented it, right? The information?
It was me or Greg, we both signed
Yeah.
about it.
I reviewed
Because I remember it was pretty in depth.
why we're doing it.
Okay.
Can answer whatever questions anyone has.
John, your vote?
Yes.
Fred, your
Yes.
vote? I keep. looking
Mark
at
your
you.
vote.
Mark your vote. Ross, your vote.
Yes.
Jean, your
Yes.
vote, and I'm a yes.
I'm a yes.
Thank you, Mark.
Thank you.
Sorry, I bought my tickets from somebody else. Just kidding.
You've got funny.
Oh, yeah. Okay, the second one, the resolution is 24-04, resolution for the adoption of the cafeteria plan action. It's action item. So does anybody have any questions on that?
That I don't, but I'm. When did we bring it to the board about the percentage that the hospital pays for an employee pay? Cafeteria plan, this is just a generic for whatever, which it has to be done, I understand that. But when did we approve it? It seems like we should try to be a little better to the employees if possible. My understanding is 70% right now, they pay 30%. And, who went over that? Who approved that?
We covered that, you said 2 years ago, Heidi?
So we approved the same resolution 2 years ago, but as far as the percentage that the hospital pays, what the employees pay, I don't remember there being conversation. Was there anything that you're aware of, Sarah?
No, there's nothing I'm aware of. It's something that Mallory goes in and she does every year. She updates if there's any changes.
Well,
If there were no changes, she just basically filled out, the
I would like to see a copy of what it is. How do we, most people don't even know what it is. The employees do, but most of the board members don't have it. And I think we're light on what we should be doing for employees. That's my feelings. So if we approve this, are we approving that also?
So what we're doing on this one here, if it's a every 2-year thing, that means it was done, I think, before I was here. So I don't know what it was approved. I just know that what she actually had to do was go in there and update if there was any change to it, which there wasn't a change. So she goes in there.
Why wasn't there a change? Was there who decides if there's a change or not?
To be honest, I would think that, I would have guessed that it would be because of maybe the amount they pay, like the employees pay.
Right.
But I don't believe there was a change. And if it's every 2-year thing, I would say Tim would have approved that.
And excuse me, I don't think it is a every 2-year thing.
Okay.
I mean, I just said that because that's when I think we
That was the
Look
last
at it.
resolution that we
approved, yeah. So, but, and if there's no changes, but yeah, I don't know if Tim would, bring information to us or if Tim
Well,
wanted
this
to.
needs to be done now because of the timing, I think. But I would, if there's any way that we could look, because
For the hospital to pay more towards their insurance and
getting
stuff.
beat up with just the way it's been for the last 4 or 5 years.
want us to put it on as an agenda item for like board personnel and policy for them to discuss, and we can look at what the breakdown is.
Yes,
Okay,
As far as
if
what
we
the
approve it
employees-
now, we stuck for another year now.
yes.
We're already kind of stuck. We're already in the plan year. The plan year started July 1st.
Next.
But we could get more details for you, and Tim may have information if we want to add it to the board personnel policy committee.
Yeah, and there could be a way we could change it now, even though we started, we could put an addendum on it, because
Yeah, and I don't know if we can make any changes after, till next year. I don't know if we do it before we sign up for the next year's plan, if there's changes.
we'll
But
ask
we can-
our attorney.
We will ask our attorney before he goes golfing.
Once we approve this, can we make a change?
I don't know the answer to that question. We would have to talk to the plan administrator to determine that answer. And I just don't have that information.
Okay, so the plan administrator should have brought it, or somewhere or other, it should have been brought through the board prior to now, because to the best of, I looked through it and I didn't see what our current plan is. I know what the cafeteria plan is, what's available, or what available, but not what it really is. Am I making sense?
You are. Yep, I hear what you're saying. And I think it probably makes sense that every time the plan is re-upped or renewed, that it goes through personnel and policy first to review it, and then through finance to analyze the costs. If the board wants to change its percentage contribution, of course, you have to determine, is that financially feasible? What kind of impact does that have? So going through personnel and finance makes sense to me.
Okay, it didn't go through it this year though. Okay,
Gene, if it would help, I could find other hospitals and what the percentage they pay. for their-
well, we're not other hospitals. And our employees, I'm not giving your.
No, I-
your
Yes,
hospital,
because that's what.
your-
No, I don't mind. That's all right.
But
But I just say maybe that would help the decision-making process.
with everything that's been happening, their wages have been going down every year, a little bit. And any little bit we can do to help them. I'd like to see if we can, but it seems like this year is too late.
So on this matter, it sounds like you have questions about it. I do too. Is this something that we can continue and have reconsidered when Tim's available, maybe at the building and planning meeting, our special board meeting in a couple of weeks?
I think so. Mallory had said that we could wait. I just got it Friday, which is why there was the late addition to the agenda.
Okay.
So if you guys have questions, it has to wait. Not really a lot to do.
Yeah, I don't know if it's something we want to approve today. There's
Right.
still too many outstanding questions about it, so.
Well, and
Well, just so you're aware that the plan is already approved, so I don't know how it's set up.
Our actions may mean nothing. I understand that.
So I believe it's already approved. What she did was she printed out what they sent her. So what you guys are actually doing right now are signing and dating what was already in place.
But we can look at our
So-
options. I agree. Now, we're gonna agree one more time.
I know it.
I think
You're gonna start sitting by him.
Yeah, you want to switch seats?
So what we're
I don't know
doing,
about you guys.
I sure would like to get
now
those
is
answers.
looking for a signature, and it's just for our records. It's nothing, there's no, it's already been, it's going for.
I realize there may not be a possibility to change what the plan is gonna look like the upcoming year, but we don't have to approve it. We don't even understand it.
Correct. So, is everybody agreeable to, take it off today,
Postpone
post
it.
it
Continue it to our next meeting,
to our next meeting, and that way it can go to,
building and planning.
building, planning, governance, whichever one.
Yeah,
all
it's in a
needs to
couple of
go.
weeks.
So, okay. So Heidi, we're gonna read.
That way, hopefully Kim will be here and, in the interim, we can get some of these questions answered. Great.
And we'll move it to the next meeting.
And if it's important for the, the plan administrator to get board approval before the cutoff date of July 1st, then maybe this needs to be put into motion sooner.
Yeah,
Got it late. I asked if we needed to get it on the agenda immediately because I had posted the day before. Mallory said that she had it for about a month before she gave it to us.
So, what?
I don't know why or how what
Yeah.
happened exactly, but she said she had it for a bit, so maybe it would have been a little more time there, would have had time to answer questions beforehand, but.
If I may,
Yes.
in one of the question and answers, this is question 10, how long will the cafeteria plan remain in effect? And it says there that although the employer expects to maintain the cafeteria plan indefinitely, it has the right to amend or terminate all or any part of the cafeteria plan at any time for any reason.
okay, that's good. Thank you.
Okay.
So we could approve it now and you just go ahead and make the changes if we wanted.
Yes,
It's,
that's how I interpret their answer to the question.
So it don't make any difference if we approve it now or not. It can be
I think if
changed.
we wait a couple of weeks after
Okay,
sending
well,
traditional,
okay.
that we can
If
explain.
we need a motion to table it, or whatever we'll do.
Yeah.
I don't think we have to vote on that, do we?
Just a motion.
Just a motion.
Okay.
Do I need a motion, Scott, on that?
So this plan is indefinite. So I'm trying to see what we're asking you to approve here.
There's a resolution with it.
Yep, that's where I'm going to. I mean, if they just require a resolution that you're going to continue the plan, let me see. Yeah, let's go ahead and let's adopt the resolution. And then if the board wants to go back and look at its contributions to the plan or any other part of it, then you can take your time to do that and you won't be under any rush or impending deadline. It looks like the plan is asking just for legal documentation that you're re-upping for another year.
I changed my motion to adopting with is presented. Right?
Okay, this way, we're gonna change it. We're gonna keep it on here on the agenda. You're saying that, you're making a motion.
Accepted it as the way it is.
Do I have a second?
I'll second. With the provision that Heidi puts it on the building and planning meeting agenda, not the resolution, but the plan itself, so we can talk about it.
Sure.
Get our questions in.
John, your vote?
Yes.
Fred, your vote?
Yes.
Jean?
Yes.
Russ?
Yes.
And I'm a yes. Thank you to the board for all the questions and stuff, because, I read it and I knew the reason why it was put on there at the last minute and stuff, but, yeah, I think it's something that we need to make sure gets on the, agenda and stuff a couple of months before, so if we have any questions, we can follow up with that. Okay, thank you. So, we're going to move to director's comments. Ross, do you have any?
I just wish it were cooler.
Yeah, I get that.
Our community needs some relief from the heat, but thank you.
Jean?
Does anyone here or anyone that's out there have an air conditioner that I could borrow?
Got a bag of ice I put on your head.
Those little mini splits, that office building in Isabella, I got two of those, the cheapest, they were good. Really were good with mini splits.
Huh.
So,
Good to know.
thank you.
We'll be over at your house then. Right.
John, just want to say, welcome to the team. Looking forward to see a fresh set of eyes on the numbers and see what you're going to be able to put in front of us to let us know if things are correct, incorrect, and how we're going to move forward with the end.
Thank you.
So,
Yeah, this is what you got. This is your meeting right here, so. John, do you have any comments?
Yeah, I wish it was cooler here in Texas too, but if not, there was some residual effects from that hurricane, but that was about it. So yeah, not much cooler here than it is in California, unfortunately. But did want to say welcome to the healthcare district, John. I'm sorry I can't be there in person because I'm at a conference, but you'll be working with me about once a month because I'm the board treasurer this year. So you'll see me later in the month.
Good.
So welcome.
Thank you.
And again, I would like to welcome you too. I know Jean got to meet you, but you heard I was coming and you left like 5 minutes before I got here, so.
I would have waited if I'd known.
It's all right. But I think as a board, I think we're doing a good job with our questions. I think I've learned a lot, I know who does the who catches what information? Ross, if there's a punctuation or spelling or something, he'll, you know, call you on it. And, so, and Jean, if there's anything to do with the employees, better for the employees, everybody agrees, but that's, you know, and we appreciate that. And Fred, you need to, find out what's going on with your nerves.
I
So,
don't mind.
yeah, no. So, I just appreciate, you know, the being, you know, first chair that you really like pick me under the table and stuff as needed. So
I didn't use a cattle prod.
I know. I appreciate that very much. So that's a plus. And John, you, I want to say are, like playing, you know, Where's Waldo? Because you're all over the place sometimes, but I just appreciate all the stuff that, that you do and information you've provided for me for being in this position too. So I want to thank you guys for that. It's,
Welcome.
I don't know that I feel if we make a difference or not. I don't know how you guys feel, but there's some days I think, you know, what we want to approve and what we suggest doesn't always come timely, or if it comes at all. And so those are concerns that I have. So, other than that, I just want us to be good stewards of, you know, the community's funds, and always want to, you know, try to do what's right. I know we depend on Scott for that, but today's just when he's sitting in a nice, cool area. So thank you for your information on there too and answering our questions. So, and then we did talk about, we removed the closed session, so there will not be a closed session.
Yep.
Or a closed session report, because there are no new changes or anything, information on that. And so it is 2:58 PM and the board meeting is adjourned.
Thanks all. Hope you stay cool.
Have a good day.
Good luck on the links.
Yeah.
Yeah.